Conceiving a child is often described as a miracle or blessing. Some of us have grown up hearing nursery rhymes that plan out the perfect life. First comes love, then marriage, then comes the baby in the baby carriage. But life isn't always this simple. Infertility is still a very common problem in the US. The CDC reports that around 1 in 5 couples can't get pregnant after 1 year of trying. And though historically much of the focus around infertility has been centered around women, it's an issue that affects men equally.
About half of the time, there's a male component that's either the only problem in the equation or one of two problems, the other being from the female side of the equation. And so when we see men in clinic, we're first very happy to see them because we as a society don't talk about fertility much or infertility, and we really don't talk about male infertility at all. And most people don't recognize the importance of the male factor and how commonly it can go wrong and contribute to their difficulty.
That's Dr. Scott Lundy, Director of Male Infertility in the Glickman Urological and Kidney Institute at the Cleveland Clinic. He says men usually wait longer than women to seek help for fertility issues.
I think in general, men are a little bit more reluctant to talk about private issues like sexuality or erections or fertility. It's thought of as a weakness in a way to describe these very masculine things, and potentially these things may be problematic for these men. And it's a sign of weakness potentially to talk about them. And I think that's really a travesty because our society a disservice by not recognizing them as medical conditions and describe how many of these men have treatments that are available that can fix their problems or at least help their problems.
Couples are encouraged to test their fertility after 1 year of trying for a pregnancy. However, Lundy says that doesn't mean they have to wait for the year mark, especially for older couples where time is a big factor in fertility.
We're happy to see couples at any point along their journey because for some couples, the anxiety starts the first month that they don't get pregnant. And we can provide a lot of reassurance to these families that even if everything is perfect, biologically speaking, pregnancy rates are only about 15 to 20% any given month. So if you calculate that out, it takes 5 or 6 months to cause a pregnancy, even when everything else is ideal.
Not to mention if there is an issue. Male infertility can be caused by a wide range of both biological and non-biological factors. Lundy says it's a spectrum that can affect men who have nearly normal sperm counts or men who have no sperm in their ejaculate at all. The latter is the most severe condition within infertility called azoospermia, which can either be caused by genetic abnormalities or lifestyle factors.
They may have had chemotherapy in the past because they've had cancer and this damages their sperm stem cells. They may have a blockage as well, particularly for men who have had hernia repairs on both sides, for example. Or another example would be a man who's had a vasectomy. He doesn't have any sperm in his ejaculate because we've blocked that pathway. And so our job is to identify how severe the problem is and then begin to tease out what the underlying cause is and attempt to correct them when we can.
Lundy says it's often difficult to narrow the exact cause of infertility down to just one factor. However, he recommends similar changes for most patients. Maintaining a healthy diet and exercise regimen can make all the difference when it comes to fertility. On top of this, limiting alcohol and tobacco use is highly recommended. And while these basic lifestyle changes seem like common sense, Lundy says many men don't take these factors into consideration. He thinks it's time for more providers to talk to men more consistently about fertility issues.
In men who have infertility and a male factor to the couple's fertility, those men are at increased risk for major health problems or even early death. And we don't know why that is, but there's a number of studies now that have confirmed this finding. And so getting these men in to see us when there's a possibility of fertility really opens the door for further medical care and allows us to treat not only their fertility, but other aspects of their health they may have neglected or have not been identified because they haven't seen a doctor in a decade.
When a man is worried about his fertility, Lundy says the first step is to learn about the patient's medical history and identify any risk factors.
For example, if they've had testicular cancer, they may be at risk for infertility. Or if they've been around pesticides or radiation or any number of other risk factors, these can contribute significantly. Or even something as simple as using a hot tub on a daily or weekly basis can have significant consequences on their fertility as well. So finding out as much as we can about the patient and learning about them is first. And then performing a really careful exam is the next key step.
Lundy says this penile and testicular exam only takes about 2 minutes, but doctors feel for numerous structures within that quick time frame.
There are 15 to 20 data points that we collect in those 2 minutes. And this is all in the context of a very awkward exam for them. So we try and do it as smoothly and as quickly as possible and avoid pain and ideally crack a few jokes along the way too. And then once we have all that information, we can have a sense of whether there's an obvious problem at play.
However, the physical exam is only the first step.
The key test for us in determining fertility status is the semen analysis, which is a test where a man comes in and either provides a specimen in the office or in the lab, or brings one in that he recently generated at home. And then we look at it under the microscope and we look for the number of sperm, whether they're swimming, what shape they are, what pH the sperm live in.
Which tells doctors if it's a harsh or favorable chemical environment. After this analysis, Lundy says the treatment option depends entirely on what's been identified as the underlying condition.
One of the most common causes of infertility that we see is something called a varicocele, which is a dilation of the veins above the testicle, usually on the left side. And what happens is this blood pools and causes these veins to dilate. And these varicoceles are present in many men, but only in a subset do they cause problems with fertility or pain.
The treatment for a varicocele is often an outpatient surgery that takes about an hour to complete, and a majority of men are able to recover their fertility. On the other hand, some fertility issues don't require surgery and can be solved through medication or basic lifestyle changes. However, if the problem is due to a genetic condition, Lundy says patients usually have to rely on assisted reproductive technology, like in vitro fertilization, to have a baby.
And so for men with severe male factor infertility, we often rely on our reproductive endocrinology colleagues on the female side to perform this procedure. And then our job is to find sperm for them. And many times this requires us to surgically go in and find sperm using a microscope from within the testicle. So we do several different flavors of that operation, but essentially our job is to carefully and meticulously look through the testicular tissue to find sperm.
And even men with the most severe form of infertility may still have viable sperm that can be surgically removed for use in IVF.
The treatment of choice is something called a microtesy, which is a surgery where we open the testicle, and it's as barbaric as it sounds. We literally open the testicle in half, and then we use an operating microscope and we tease through the tubules inside the testicle that create sperm. And we look for tubules that appear different than the other tubules. Now, we often don't know why the testicle has failed, but in many cases, there are small islands of sperm production, and those sperm simply aren't making it out into the ejaculate. And so if we can find them surgically, even if it's just a few sperm, we can often use those to fertilize eggs and cause a pregnancy.
Proving that there's still hope for men struggling with infertility. The National Infertility Association offers support and more information on their website, resolve.org. You can find out more information about Dr. Scott Lundy and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired in October 2022. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.